So let's start the last session of the day. We have two talks this evening, and the first speaker you heard earlier today. Nicki, over to you.
Thanks. Okay, great. Is this my time, or are you going to set it off? Okay, great. Okay, great. So thanks. So we're coming to the second talk, which is also a very practical talk about data management and how you define your variables. This is kind of about, in a way, good data etiquette, how you make sure that you keep clean data and data hygiene, I guess. So we'll jump right in. We're going to talk a lot about ethics next week, in the sessions next week, but I had to mention it here as well, that, that if you have any data that comes from real people, from participants, from studies, you must have ethics approval from an ethics review board before you even start. So before you receive a set of data, especially if you're using other people's data that they've collected, it's always good practice to ask for a copy of the ethics approval and read it thoroughly and keep it on file. And I especially make this suggestion because I've been provided with data in the past where I was told ethics approval was in place. So I trustingly continued with the work only to discover at the end that it actually wasn't. And it's not a great situation to be in either on two fronts. The one is that you've done work that actually wasn't ethically approved. And the second is that the participants' considerations may not have allowed for you to do the work you were doing. So you can't just trust that the person who says yes is necessarily giving you the full story, and you have to take personal responsibility by actually reading the ethics and making sure that the ethics approval covers what you want to do. So I just wanted to say that up front, and just if the person providing the data has a problem with providing you with a copy of the ethics approval, you should be asking yourself some questions around that too. Yeah. So that's just a heads up. Yeah. And then, so also to look out for the fact that sometimes ethics approval is provided for a particular study, but you need to check that there's ethics approval for secondary use. That means onward use that maybe isn't the primary study. So you have to check that secondary use ethics approval is in place before you even start looking at the data. So that allows you to use data or samples to answer research questions, which are separate from the original research question. So you really need to do your due diligence before you even get hold of the data to make sure that you are within the ethical bounds that are permitted by the data. So that's just a little caution before we even start to talk about using the data themselves. So how, I'm actually interested, how do you guys, in fact, I'll go back here. How do most of you store your data in general? Are you, Excel. Do we have flat file users? CSV, TXT, yeah, flat file. SQL users? Yeah, SQL. RedCap, which is a MySQL backend, that's right, yeah. The relational databases. So we do have some Excel spreadsheet users as well, just so that I'm stay on point. I just wanted to caution a little bit on Excel spreadsheets. So many data sets are actually stored in Excel spreadsheets, and it's not the best option. It is manageable though. And actually, regardless of whether I think it's a good option or not, it continues to be a practice that many people store data in Excel spreadsheets. So for that reason, I just wanted to flag some of the data issues that can arise with using Excel. That'll lead into talking about some of the other stuff. So some of these potential pitfalls, they can be quite hectic if it happens to your data. So it's worth being prepared in advance. So in Excel, we've noticed that data can be altered or deleted and rearranged by mistake quite easily, much more so than in the flat file kind of structures. And then Excel, the worst thing is Excel sometimes auto formats numbers and dates, and you can actually lose your information completely. And I've not yet worked out any way to undo that. So you have to be very aware that this is a potential that can happen. And then the other thing is, of course, when you delete fields from Excel, if you find out later that you didn't mean to delete them, they're gone forever. So if you're going to work in Excel, it's really, really important that you make a hard copy, a copy of the original data set that you don't use except for emergencies. And then you work on copies of your original Excel spreadsheets. So make sure that your Excel, day-to-day Excel use is not on your master copy of your data and your original copy, because it can go horribly wrong. Yeah. And the one good thing about Excel is it makes it very easy to password protect and encrypt your data. So that's a positive on the side of Excel. So you should use that password functionality and encryption functionality for any kind of sensitive health data. Another issue with data storage, and I think we're all working with health data or health-related data, is that there should be absolutely no information in the data set that can be used to identify individuals. Unless you personally, in your own right, have ethics approval to see identifying data, you should never be able to access or see identifiers for individuals in the data set. So it's also up to you to make sure before you receive data to double check with the person providing it or the organization providing it that there are absolutely no identifiers in the data. So I don't know, we have, in our province, we have a hospital number that's a unique folder number, and that potentially could link people back. You could link back through the records to who that person is. So things like folder numbers, national numbers, anything like that, it all needs to be completely removed, and some kind of arbitrary identifier that has no meaning needs to be used for data sets. I think often people, sorry, this is jumping ahead. People think that if you just take the names out, you've anonymized the data set, but that's not the case at all. Often, especially as our data sets get bigger and bigger and more granular, it's actually quite easy to link back to other data sets and work out who's who. So you have to make sure that anything that can be used for re-identification is also removed as much as it can be. Yeah, so there's a difference. De-identifying data is when you just take out some of the identifiers, but anonymizing data properly is when there's no way you could link the data set back to individuals, maybe using other data sets or other information. So wherever possible, you should really anonymize the data, not just de-identify it. But there's one exception. There's a data type we work with a lot that can't actually be properly anonymized. Anyone want to guess what it is? Kind of an easy question, I think. Exactly. That's like asking someone to anonymize your fingerprint, right? It's uniquely identifying of you, and it can always be linked back to you. So if you're working with any kind of genomic data, you have to make 100% sure that you treat it as though it's identifying. There's no such thing as anonymous genetic data. In fact, I know in our health service or in our genetic services, a paternity test uses only 90 variants to give a like 99.9% confirmation that there's an identity match for a father. So, I mean, if you think that the average data set of variants could be 2.5 million variants, it's very, very identifying. There's no way that it can be considered anonymized in any way. Yeah, so participant data needs to be well secured. You need to password protect your computer you're working on, the files you're working with. And if you have hard copies, they need to be really locked away. So this sounds like a very obvious statement, but you know those little flash drives that go around, they're often used for copying data and they are almost never BitLocked. So if you're going to transfer things on external drives, you need to use BitLocker or whatever, I don't know if that's for Mac as well. And you actually need to encrypt the drives, including flash drives. I don't know if people still use those. If you're transferring things with sensitive data via online platforms, you can't just drop sensitive health data in Google Drive or Dropbox or something like that. So you really need to think about the platform you're using to move around data, and you need to make sure that your data are encrypted and software and password protected. And yeah, you need to you need to be 100% confident that even if someone were to somehow unencrypt them, that there are no identifying data. So what we do is we separate entirely. If there has to be some kind of identifier that could potentially be identifying, we have two files. One will be the clinical data. The other one will be the demographic and individual data. And we separately encrypt them and password protect them. And we send the one with that password, and only when it's been received and deleted off the platforms, then we send the other. And there'll be an internal linker to link the two together. So we never send clinical or sensitive health data with any kind of person data. They always have to be sent individually. And then, yeah, backing up all your work. I mean, this is also kind of an ethical requirement. If you've gone to all the effort to collect data from participants and pull it all together, and maybe they've come in for visits, etc., the least you can do is protect the data, back it up, make sure you can use it well. Yeah. So in Excel, each of those data types is called a field, and it's listed in a separate column. And this is just about also using consistent language. So some people call them variables, some people call them fields, data points. And in a tab separated file, those are flat file, and the fields are separated with a tab, which personally I quite like because I find it very parsable when I code with a \T. But you can open those files just with a right click and opening them in Excel as well. So actually I would, if you really like Excel, I would actually save your file, your data as a flat file, a text file, or CSV, comma separated variable. And then you can open and work in Excel, but I wouldn't save it as Excel personally. I would keep it in the flat file format. Yeah, and you can work with the CSV. Sometimes commas can get a bit messy when you're passing data, because sometimes your fields might have commas in them, especially if there's a muddle of decimal points and commas, depending on where your data originate. So personally, I prefer the tab to separate your fields when you're writing code, but commas can also work, yeah. And I use Notepad and Notepad++ if I really want to have a quick look at data. So Notepad++, they're freeware, you can get them online. I find Notepad++ is very good if you just want to look at, it'll take the top section of a very big data file. So you can open much bigger data files than you can in Notepad. And it'll pull in the top header row, it sort of works that out. And if you code, actually Notepad++ is also okay just for scanning code, and it can sort of pick up bits and pieces that are your comments or your actual code. So that's just a little recommendation as well. A note on spaces. So in Excel, this is one of my nightmares, the trailing space. So depending on what kind of language you're coding with, if someone's entered maybe the text as yes or no, and there's a space at the end, like with the spacer bar, some of the code will read that in as yes, a space, and read that as different as yes, no space. Do you know what I mean? Yeah, so that's another reason I don't like Excel, is because it's very easy to add in extra spaces and text, etc., and it can really mess with how you pass your data in. But yeah, and it depends on the stat software you use. Some of the stat software is very fussy, and some of it can kind of cope with those things. And then the other thing that I find when people enter data in spreadsheets, they often put spaces in the fields instead of an underscore or joining. Personally, I don't like camel cases where you use a combination of capitals, and so if your data was, your variable was never smoked, camel case would be a capital N, EVR, and then a capital S, MOKED. So again, depending on the software you use, like if you write in R, I mean, that's a walking disaster for me because I can never remember what I'm capitalizing or not. And I spend a lot of time debugging my code because of capitalization. So I tend to work lowercase only, and if I want a space, I use an underscore. And then I find that we don't get a mess when we're trying to code down the line. So I know these are very like minor tips, but actually if these are habits you pick up very early, your coding life and your analysis life is going to be a lot easier, and you're going to have a lot less time trying to clean up your data as you go and finding problems as you go. which is tedious, and it's kind of how I learned. So I'm trying to sort of shortcut some of these painful learnings. Yeah, so yeah, when you capture data, you want to avoid spaces, you don't want capitalization issues. And then the other big one that you see a lot is multiple ways of entering the same data. So especially if you're getting big data sets that have been collected in the field and maybe you were not even involved in the collection, you're going to see this depending on how well the data were collected and how well the design of collection was done. You're going to have a lot of messy stuff where people have written things in different ways. I still see a huge number of data collection tools where there's no restriction on what can be entered in the field. So dates are entered in all sorts of formats. You can have text in boxes that's supposed to be numbers only, and it's just really messy. So you can expect if you're getting secondary use of data that you're going to find these things in at least some of the fields. So just be ready and be prepared to go through, yeah, and look for these things. So if you're building the collection systems and you are using something like Excel or REDCap, it's up to you to really clean up the data collection system so you don't run into these problems further down the line. So here, like even yes or no, you would think would be an incredibly easy entry to pass. But you know, if it's not a properly restricted field when it's being collected, some people have Y, some people have N, it'll be capital, it'll be small, it'll be yes, no, 0, 1, and then the mystical entry of blank. So, I mean, who knows? Does that mean the person didn't come in that day? We couldn't collect that information. I forgot. No. I mean, it's absolutely a meaningless field. So, yeah. Yeah, so data coding is about in what form the data are actually stored. If you're going to do analysis of data and big data, you need to know what coding was used. And the other one that I see a lot of is greater than or less than, sort of incorporated in a non-standardized way. So in a numerical field that's not properly constrained, someone's got greater than 10. But you can't pass that in a analysis, a data analysis. It's just going to be chucked out, and you're going to lose that row of data if you're running integration or something. So you've got to be very careful to look for these things. Don't assume your numerical field is numerical. It's quite possible that it isn't. You'd think it would be difficult to mess up entering numbers, but people do it all the time. Yeah. And then, yeah, also where you do see coding, 0 is yes, 0 is no, 1 is yes. Don't assume that there's only 0 and 1, because often, and especially epidemiologists use, sometimes 9 means there's no data, or sometimes there's a never, sometimes, often. So sometimes you think it's 0, 1, but actually there are a whole lot of different numbers that all mean different things. So you can ask for, sometimes people call it a code book, how they collected the data, how they coded the data. You really need to actually look at that stuff. You can't just dive into a data set and hope for the best and assume you know, because it seems obvious, you know that that's how it was done. I mean, one that catches us in our routine health data is people expect that they will be male or female and that's it. But we actually have male, female, indeterminate, unknown, and there's a fifth one that I can't even remember. So people who work with the data get very annoyed because they do things, analysis by sex, and then it doesn't add up to the total. And they feel all irritated that there's suddenly these other fields. But actually, if they'd just done a check up front, they would have realized pretty quickly, or if they'd just read the documentation, they would know that there are these different fields that it's not immediately obvious that there are only 2 options, yeah. Sorry, did it jump? Yeah, so it's about doing your due diligence before you dive in. It's really boring. And the other thing that I hear a lot from people doing these kind of analyses is that they didn't realize how long the data cleaning would take. So I'm sure all of you can relate to this. I would say for our studies that we do in my group, data cleaning and understanding the data structure, it's probably 80% of the time. By the time you've got it all sorted out, running a regression in R takes less than a second, really. I mean, it just takes a minute to write the line of code and a second to run it. But getting to the point where you understand enough to make that call and run that analysis, that's a whole other story. And that's actually the hard work. So the stuff I'm talking about here, it's the unglamorous side of doing data analysis. And you certainly wouldn't be able to do effective machine learning if you haven't understood how your data are coded, what are the options in each field, how much of it is rubbish, et cetera, et cetera. So it's boring, but it's very necessary. Yeah. So a variable, we've already gone over this, a variable, a feature, a field, a data point. It's the characteristic, the number or the quantity that increases or decreases over time or takes different values in different situations, i.e. the data types that have been collected from the individuals in the study. I already mentioned this, I think, but the outcome you're investigating is the dependent variable, and this was mentioned also in some other lectures, and it's often denoted as Y, the outcome. And the exposures or the other variables that may or may not cause the outcome are called the independent variables, risk factors, confounders, what other ones have I missed? There are lots of different ways to describe these exposures, etc. And there can be multiple ones. In fact, we very seldom do univariate or bivariate analysis with only an outcome and one risk factor. That's the whole basis of machine learning, is this extensively multivariate analysis. So you're going to have lots of X's, X1, X2, X3. These are all your different independent variables that might or might not be associated with changes in the outcome. So I want to talk about these because I think this is something I see tripping up people in the research space where I work, people I'm training all the time. So I talk about a conceptual variable. And what I mean by this is, what is the concept that you're trying to measure? And then an operational variable, which means what do you actually measure on the ground? So often when I ask people, what is it that you want to measure? They will give me the conceptual variable. It's the idea of what they're trying to capture. Whereas the operational variable is what is going to be the data point that you enter into a database at this point. And they're both useful. So they're both important, but you need to work out in your head, what is the conceptual variable I'm trying to capture? And what is the actual operational variable that gets measured? And actually, is one a true measure of the other, or is it a proxy? Or are we going to need to collect several operational variables to talk to the single conceptual variable? And I think this kind of thinking about your data can help you a lot when you get to the interpreting stage as well. Because it's one thing having loads and loads of variables and an exciting outcome. But if you haven't really thought about exactly how your variables relate to the conceptual outcome that you want to talk about, you're going to struggle to join the dots at the end when you've got all the numbers. So here I've got some examples. A conceptual variable, I mean, the most sort of abstract I could think of is health status, right? I'm going to measure the health status of the people in my study. So intuitively, you kind of know what I mean. I mean, are they well? Are they in good health? Or are they a bit poorly, feeling unwell? But really, it's not like there's a health status number that we can just write down. So sorry, this keeps preempting me. And the other one is obesity. So we also read a huge amount about obesity, but actually it's not like I'm going to come to you and say my obesity measure is 7. I mean, there isn't a scale that is so obvious that you go and meet a person and do one measurement. So if you think about operational measurements for health status, you could think about blood pressure, BMI, although we know that one's a bit of a dodgy one actually for health status. But again, the point being that they're not all perfect, but they maybe point towards our operational, our conceptual variable. So together they might be able to give you an overall picture of what it is you're trying to measure. And then for obesity, I think currently people normally look at height, weight, and then hip to waist ratio. So those would be, for example, some of the measures, but as clinicians, I'm sure you have many more that you use. So again, I think I think it's quite important to lock down what you're trying to look at in your data, because I think a lot of us who love working with data and find it fascinating and find the methodology fascinating run the risk of being people who have a good method looking for a question, right? It's not a good way to do research. There's methodological research, which is great, but if you want to do research, health research, you need to have the question first and work out how it is you plan to answer the question. So understanding what's the conceptual variable that you want to focus on, how the data are going to operationally contribute to measuring that conceptual variable will help you to frame sensible research questions and will help you to direct your interpretation in a kind of meaningful way or in a theory-driven way rather than just based on the outputs of whatever great analysis you've run. That would be my recommendation. Data types, we also heard about this yesterday briefly. We've got different data types, and it's worth keeping in mind what these are as you work with data. Numerical data, these are quantitative data. It's a numerical measure and a number. It can be continuous, so that's data that can fall anywhere along a range of numbers, height, weight, age, blood pressure. I know this is a refresher for most of you, but it's a good reminder. And then discrete numerical data that can only fall at specific values, normally integers, so like a count. So a number of patients treated, number of children, parity, those can only be whole numbers. So those are discrete numerical data. Categorical data, they don't have a numerical value, but they're sorted by category. So color, gender, country of origin, but they can have some kind of implied order. So never, sometimes, always, you can feel a sense of scale from one end to the other. Below 20, 20 to 50, and above 50, they're categories, but there's a natural order of events. So those are ordinal categorical data. And nominal is when there's no implied order. I hope I got this the right way around. And then obviously the special case where there are only two categories, 0 or 1, binary data. Yeah, so again, don't always assume it's binary just because you saw majority zeros and ones. You don't know what else is hidden in that column of numbers. Yeah. And then just to mention binning data, this doesn't mean throwing away, as some of my undergrads thought. Sometimes with complex data, it may make more sense to bin a continuous numerical value into categories. So one of those we see, because we do a lot of work with HIV data, viral load count, for example. It doesn't make sense to put in a viral load count into a regression model, for example, where a change of 1 is really going to be not interpretable. So we have specific bins that match kind of thresholds that have clinical relevance. And so we'll look at the actual viral load measurements, and then we'll create a category based on which category they fall in. So yeah, you can have age in years as a numerical continuous data, but you could have an age category as ordinal categorical data. And I would also caution you, if you're making these new variables, to have descriptive names so that you don't get confused when you're trying to run your analysis and you're trying to put age in and then age in years. You forgot that that's actually, you've named it age in years and it's a category, but you also have age, which is numerical. So try and keep your naming a little descriptive so you don't get lost along the way. So why do we care about what kind of data we have? So obviously just being able to pass the data is very important, but also the different statistical tests are designed to handle different types of variables. So if you're not completely clear on what your variable type is, you could do the wrong type of analysis. And personally, I think running any kind of algorithms and stats analyses with code is quite scary because you always get an answer out. And it always looks quite convincing, but it can be absolute rubbish. So if you haven't really done your due diligence on your data types and how you're handling the data, it can look very pretty, but it's absolute garbage. Yeah, garbage in, garbage out. It's such a trite saying, but it's so absolutely true. So when you're designing a study, or at the very latest, before you do any analysis, you need to summarize what kind of data you have in a table. And then draw up this variable table before you see the statistician, and they will be your friend. I know we've got one statistician in the audience. Do you have any more? Only pure statisticians who have people coming with these kind of data? No? Yeah, so if you want to be a statistician's friend, I hope you support me on this. Draw up a variable table that looks something like this. How's the text? Yeah, you've got the name of the variable, the description of what's in there, the type of data, and then how it's been coded. Yeah. And this will make everyone speak the same language. It will force you to do your due diligence, so you know exactly what you're working with. And then when you're trying to get help from a statistician, which I hope you will do at some point or other, you're going to be able to talk the same language because you're going to all know what you're actually looking at. Yeah. And then obviously it helps if you know what your outcome of interest is and which are your risk factors of interest or your independent variables in your, if you've got a clear research question, you've got that sorted out. So when can we do data sharing? It's a question we're going to also explore on the ethical side and governance side as well next week. But in practical terms, when can we do data sharing? And one of the key points is when the data can actually be compared or combined. So meta-analyses is when people bring together different data sets, they join them up into one big data set, and then they have a much larger data set to be able to get the kind of statistical power that they want to, that they need to be able to make some inferences from the data. And the other way we often want to compare data is validation. So maybe we've done something in one data set over here, and we'd like to see if it holds true in another data set over there. Internal validation from the same population, external validation from external populations, it's all important. So I want to talk a little bit about data standardization, which is about collecting the data in a standardized way, which matches how other people collect their data. And then data harmonization. Data harmonization is when you try and retrofit data sets so that they can be combined and so they can talk to each other. So even though you collected the same metrics, maybe you didn't collect them in exactly the same way, and yet you're still going to try and retrofit this joining. So do you know what is the most common data standard used by clinicians? We're now talking about data standards as a kind of methodological or technical tool. Sorry? OMOP, yes, but what is the actual standard that most clinicians use on an almost daily basis? ICD-10, ICD-11, right? It's a data standard that codes how we capture conditions. Do the clinicians agree? There's like heavy silence. Okay, yeah, so that's another conversation. We could talk about that another day. Okay, what should clinicians be using every day when they capture data? Yeah, ICD-10, ICD-11. Do people know what that is? Yeah, anyone doesn't know wants me to go in it, but okay, so ICD-10 is, it's a kind of classification system that tells us, I actually can't remember, embarrassingly, what ICD stands for, International Classification of Disease, something like that, yeah. So this is an internationally agreed structure of how we name diseases or conditions in human patients. And it's hierarchical, so you can have parent terms that then encapsulate a whole lot of conditions that fit under that parent term. So there is a structure almost like a tree of ICD-10 terms, terminologies, names, and then as you go down the tree, it gets more and more specific. So because of the hierarchy of this system, if you, it makes it machine readable. That's one point, because it's a standardized system with relationships. So if you want to capture all diseases that fall under a certain term, when you name that term, it can automatically specify that that term includes all the child terms underneath. So it's a, sorry, if I sort of assumed everyone's working with this routinely, so I didn't include like a picture of a piece of the ICD-10 tree. But anyway, it's a standardized way of capturing disease conditions or health conditions that is used internationally. And in fact, yeah, when clinicians see a patient and they capture that in a database or in a medical record, in theory, they should be using ICD-10 codes. So where you see very good ICD-10 coding is in the health insurance industry, private health insurance, because everything is centered around payment. So if the ICD-10 code is not there, they can't work out what's the correct reimbursement rate. So you will see doctors seeing patients for where it's going to be paid for by private health insurance are meticulous about capturing ICD-10 codes. Yeah. So others that you might use frequently, but now I'm not so sure. Does anyone work with pharmacy data and use ATC coding? It's a standardized way to capture the names of standardly used medications. So it's, yeah, it's like a universal dictionary of this is how we name these things. LOINC codes are for labs, laboratory data. The LOINC codes, that's a universal code, a universal standard that people use. So you also have local standards that might be used. So for example, the NHLS, the National Health Laboratory Service in South Africa, they used to use an ontology or a standard called DISA. And then at some point they changed over to TRAC. And this was quite a nightmare in analyzing the data because we have data from the DISA period and data from the TRAC period. So we had to map all the terms that were used in DISA and how they translate to TRAC so that we could look at continuity of laboratory data over time. Because the standard they used to capture the data changed at a certain point. I mean, it upgraded, it was a good change, but it's a pain point when that system changes. I will say, however, at least it was standardized so that there was a standard way of mapping that then would work for all the data going forward. Yeah. And then there are also specifications. So these are a little bit different. They're also standards, but they're specific structures and ways of moving data around. So has anyone heard of the HL7 spec or the FIRE spec? So these are used for moving medical records, yeah. And they are standardized kind of containers in a way. If you're going to pass these data from the phone to the medical database, this is the structure you use. If everybody uses the same structure, it's much easier to move your data from A to B because it comes in a standardized kind of container or a standardized data structure. So yeah, data standards, these answer the questions from earlier this morning of how do you make sure that you're capturing the same kinds of data? People use data standards. And there are many more data standards. I just put a few examples here. But if you're going to do any kind of research where you're capturing the data, you should be looking for data standards in your field and making sure that you comply with whatever the most current and most commonly used data standards are for the kind of data you're going to collect. So ontologies, I just want to introduce the term. I'm talking about hierarchical. So data standards can be kind of hierarchical data structures like ICD-10, and that would also be described as an ontology. There's a structure, there's some kind of hierarchy and relationships with parent terms and child terms. They don't actually have to be only unidirectional, and I'll show you the gene ontology. I think I've got a little snippet of the gene ontology here. So they can actually be cyclic. They don't have to be only acyclic. There's also the Phoenix ontology, which is a phenotype diversity ontology that's being developed all the time. You can find ontologies and these kind of data standards everywhere. They are actually out there. So an ontology describes the terms and how they relate to each other. A data standard, particularly in health, will also often give you information about how you should collect that data point. So if it's blood pressure, the data standard will also provide you the information about should your participant or your healthcare client be seated, standing, etc. Must you take 3 readings? I don't know, I'm not a clinician, but you get the idea that there will be a standard way of collecting the data, of capturing the data, of coding the data in the data standard. So gene ontology is, it's a huge collection of ontologies where you have these different terms that are connected sort of in a graphical way. So let's see, yeah, here. So the gene ontology is not acyclic, so it can have these more circular relationships. But the nodes are the genes or the cellular structures or the functions. Actually, last time I checked, there were 4 different ontologies. One was cell location, I think. One is function, et cetera, et cetera. So there are different ontologies for different types of information about the kind of genetic environment. And then the edges, the lines that join the nodes, those actually have meanings. They're relationships. So the most common edge that you'll see in ontology is a. So I don't know, I'm trying to think of a breast cancer is a cancer. So cancer would be the parent term, and then breast cancer would be the child term. So part of the reason you have this structure again is because it's machine readable. So a machine can know when you say cancer, and I'm just using this as a blunt example, it's not exactly how it appears, but it knows that that includes breast cancer, prostate cancer, all the other types of cancer. Or it might be cancers, pediatric cancers, adult cancers, and then they have more child terms. But the machine can read those nodes and the relationships between them. Other relations is part of. So in cellular location, nucleus is part of the cell, for example. Yeah, or nucleolus is part of the nucleus. So the edges can have meaning, and that can be more or less complex depending on the ontology you're looking at. And then regulates A, regulates B, for example. These all help to structure your information in your big data kind of scenarios in a way that makes it manageable and makes it possible to extract the best possible information out of your systems. So maybe you're looking at, you've got a set of genetic data and you've got, 5,000 genes. You could use gene ontology to kind of group them according to their location or according to their function or their mechanism, their biological mechanism. So you could harness ontologies to kind of group your data. It's almost like informed feature selection in a funny way. But you can only do that if the data are being collected in a way that you can apply the ontology, right? So if you're collecting the data, you should be using the ontology terms in order to be able to come back and harness the functionality. So you can also use these ontologies just as a controlled vocabulary. Maybe you don't want to know all the infrastructure. You just want to name your fields in a way that's universally recognized. So you also can decide that you're not going to use all this, the meaning between the nodes, but you can still use the naming conventions from the ontologies to make sure that when people write code and they want to maybe pull your data and their data together, you've used the consistent naming conventions by using those ontologies to pull out your common field names that are used. Yeah, so when you build your variable dictionary and you're designing your study, you can decide your variable names and descriptions and standardize to common terminology. Yeah. Data harmonization is, it's also one of those things I don't recommend along with systematic reviews. It's an incredibly painful process. So people get very enthusiastic about joining up data sets. They think it's going to be great. We're going to do this big meta-analysis. It's going to be fantastic. And when it comes to the crunch, it's actually very difficult to pull together data sets that were not built separately with the same data structure. So to match the fields and work out which fields are equivalent and which are not, it's incredibly time consuming and it's incredibly painful. And it's often the work of an unsung hero, because people don't realize how excruciating it is to do this. And they think that the statistician who just whips it together, they don't recognize the hours of frustration and hair tearing and tears that accompanied the process. It's a dreadful process. And it's very, sometimes the data just can't be matched. So if I think about the TB work, sometimes we see ever had TB, has current TB, presenting with TB, because of course we have latent TB and we have TB that's actually clinically evident. How many TB episodes? These are all fields that get captured to represent tuberculosis in a participant. And sometimes they just actually can't mean the same thing. And then you lose the possibility to do the analysis together. So this is just telling you about one of our studies. It was a very interesting and rewarding study. I worked at CIDRI Africa, which focuses on TB work. And we realized that they were running these fantastic, very detailed clinical studies, doing great work. But each time they had a new study that came up, they would build a new database to collect the data. And they didn't harmonize their data at all in how they collected the data. So what we did, and I say we because really it was a big group, we collected all the data collection frameworks they'd used and all their code books, and we essentially worked out what were all the common fields, and we standardized a set of core fields, and then we also built additional modules. So if you were doing biochemical studies, then you would add in this module with these. If you were doing immunological studies, here's another module with these. And we built a REDCap template it's openly available for anyone doing TB studies can download the template. Then you can modify it to suit the actual study you're doing, but all the standardized terms are preloaded. So all the fields are there already in their standardized format. So all the TB studies that you do going forward will be harmonizable because you've used this as a standard. And obviously we used existing standards to try and get this as in line with kind of other study groups, et cetera, and the way people are standardizing TB data out there. So it was a very nice project to try and build a tool that makes it easier to make data standard. Yeah. And then as data sets get larger, just to say also, you're unlikely to look at all your raw data. So, I mean, often I'm sure you experience this, the data sets are too big to actually open them up and look at them. So how do you know that your data are clean or whether these problems exist? So the first thing you should do really is to get a sense of your data, do some univariate analysis, do some plots, do some distribution figures. Anyway, if you're like me and you don't code as often as you'd like, this is a good way to pull out your rusty skills and get cracking on the data set, get familiar with the variables, but make sure you can check out each of the variables that you're going to be using in your data set by drawing a bar graph or drawing a histogram or a scatter plot or whatever it is you want to draw. So you can just look at what's in the data set. And then you can also pull out some aggregates. So means, medians, counts. Counts are very important because that's how you're going to know if they're missing data or if you're counting the wrong kind of data. And ranges and maximum and minimum values are surprisingly useful in sort of doing data hygiene. And then the other thing we found very useful with the routine health data is looking for nonsensical data. We call this our sanity checks. So if you look at the date of the birth and the date of death of an individual, I mean, very clearly the date of death shouldn't precede the date of birth. And yet inevitably in the very large data sets, due to typos and data entry errors, you're going to find a couple of people who, according to the data, were definitely deceased long before they were born. And it's just a flag for you. You get a sense of how many of those types of errors you can expect to find. Another one is current age. So if someone is 142 in this study, you can also raise a flag that there's an error in those data somewhere. Sex-based phenotypes, so someone with ovarian cancer is assigned a male sex. You can also flag how many of the data errors you can expect to find where sex is misassigned to your participants. So checking these kind of things gives you a sense of the kind of errors you can expect and the extent of those errors. Is it 50% of the data? Is it 1% that you're looking at? Something else I've found very useful, upper and lower limits of biological measures. So if somebody has a heart rate of, I don't know, clinicians 270, you can pretty much guarantee that there's an error somewhere in the capture of the information. Or if their heart rate is 4, you can also be a little bit alarmed. The other one we found is birth weights. So we have a struggle sometimes in data sets, birth weights in kilograms, birth weights in grams. And if it's not properly constrained in the collections with proper upper and lower limits on what can be captured, you can have data sets with children who were, 253 kilograms or something crazy, or 900 or 1,900 kilograms. So we see that a lot with birth weights, that grams and kilograms get mixed up together. So looking at upper and lower levels of biologically feasible parameters is really helpful. And then identifying outliers and inspecting those data elements. So although it sounds pedantic, wherever you find an error, pulling the data for that individual and actually working through lines of data is very, very helpful. It's excruciating and it feels painful. And you do feel at some point like you're drowning. But actually, you really get to understand the data when you look at data sets where there's a problem. And I think I've just got one, oops, I don't know what I did. Have I got one more? Yeah, I just want to also briefly touch on this. I don't want to go into it for a couple of reasons. The one is that I'm statistically not the person to go into detail on data missingness. I don't know enough to be able to teach it onwards. But I just want to flag missing data. You need to know what data are missing from your data set, and you need to check whether the data are actually randomly missing or whether there's a systematic missingness of data. So again, I'm not going to go into the details because I don't believe I'm the right person to really talk about how you assess these things. But I just want to say there are different categories of missingness. There's missing completely at random, where you can show that, I mean, this is actually quite rare, but that the data are truly missing at random. There are no other variables that are pushing whether data are missing or not from certain data points in your data set. There is a possibility of being missing at random, which means that it's random within your observed data set. But missing not at random is when it's systematically related to unobserved data. So the missingness might be related to factors that you can't actually measure in your current data set. So not to get into it here, but just to say, if you have missing data, you need to categorize the data, and you need to speak to a statistician who can help you understand whether the data is, that are missing in a biased, non-random way that can result in the bias we were talking about earlier. So don't take missing data lightly, and also don't just delete all those records and pretend they weren't there. You really have to understand why data are missing, and you have to understand whether that is resulting in bias in your study before you can discount the fact that those data are not there. So this last slide is just a really big flag not to ignore the missingness of data, to take it seriously and understand which data are missing and what are the drivers that cause those data to be missing. So just flagging that. And I think that's me. Obviously, as always, to thank my funders, which I forgot on the first round. We spoke earlier about teaching material. I was chatting to some people. I said I put up the link. So a lot of what I'm talking about now, I do have teaching material online. It's open for use and reuse. It's just under Creative Commons license with attribution and not changing it. So there's all this stuff, and there's like an R tutorial related to study design that you can do, and assignments, and there's some other stuff there as well. But I just said I would put up the link for that, and please, if it's useful, there's some stuff also on writing. If you have people in the group struggle with writing papers and writing theses and that kind of thing, it's open for reuse, so feel free. Thanks.
Thanks, Nicki. We have time for a few questions. So I found that a very interesting talk, and I mean, very important because, I mean, even in bioinformatics, sometimes though the ontologies are clearer and so on, these issues crop up, but I can't imagine how you have the energy to merge these huge data sets with the, like you said, 80% of the time might go on that. Any comments from the audience on similar experiences? About your not using Excel, that again, there were 2 actual published papers on why you should not use Excel for bioinformatic data, which you're aware of, I guess. So you mentioned it converts dates. It actually converts gene names like Oct8. It'll turn it into the 8th of October and things like that. And you don't know how to do it. And there are published data sets that actually have March 31 turned into 31st March, that kind of thing. So
yeah, we call it the data mangler.
right.
That can do terrible things to your data. Yeah. Right, we're on time.
Okay, so
we've got one question, may we? Yeah.
So in some cases, when we are dealing with surveys and when we are collecting, let us say, demographic data, we get some of these instances where, let us say, you are collecting information of the occupation of the individual, and then you have got some options. So we know that, okay, those options we are really considering, but then there is the last option sometimes which is others, which is followed by a blank.
Yeah.
Like you can write whatever is the occupation. So do you think that blank is of any use? Like, I find it very disturbing, like, because we cannot make any inference out of it quantitatively, I believe. So do you have any remarks on that?
Yeah, so my thinking would be, so I do think there is a use for that, but I think what you need is a category which is other. So if you filling in a survey, you would have option 1, option 2, option 3, and option 5 would be other, which you tick. So your coding for that field will code other. Then you have a separate field. It may not look like a separate field on the form, but you then capture a text field, which is what other was. And you can use a bit of natural language processing there, and you can report on what were the other occupations. So that, I mean, it gives you a little bit more of a dimension on your own data, but it also helps you understand if you miss something crucial, so that next time you go into the field, you can add it, yeah. But you can't capture it in the same field. So you would want to capture other as one of your categories. And then in a separate field, you would have a text field where people can enter free text, yeah. Sorry? Yeah. Yeah. Because it was under other. So the text is biased and that not everyone wrote in the text that it was farming or so. Yeah, I mean, you would have to report it very carefully. You could say, you know, for people who ticked other, there was the option to add further information, although it's not complete. We estimate, we saw X% of those fields included a reference to farming, recognizing that other farmers may not have entered the text field. So if you just explain, yeah, you can share what information you did get, but you're very transparent that you know it's not everything and that it's not complete. Personally, as a reviewer, I think that that's fine. I think being very explicit about what the data do and don't offer allows you to report on incomplete data. We recognize the data are incomplete. From the data that we did receive, we recognize that we found that, yeah. And then it gives you something to say in future directions. Next time around, we're going to do X, Y, Z. Yeah, that would be my suggestion. Yeah.
I have one last comment that for those who, like Nicki, don't want to use Excel, but also don't find Notepad or similar text editors sufficiently powerful, and you just want to quickly view a CSV file, for example. There is a program called Visi Data, which I only discovered about a year ago. It works in a terminal, and it's incredibly powerful. You can for a YouTube demo of it by the author, which is completely mind-blowing. I just use it to quickly look at tabular data files, and you can quickly summarize columns and so on. So if anybody's interested, I can show you on my laptop later. So with that, thanks, Nicki.
Thanks very much.